all waste which is a biomedical, human waste, animal waste, maybe anything which is contaminated with the blood and body fluids and containing the disease causing microorganism and the viruses. So these comes under the category of the infectious waste. The entire story begins with when the infectious waste is only 15%. It's okay. It's okay in terms that this is the normal amount of 1 to 2 kilogram per kg per kg per bed per day is the normal thing which is being generated in any of the healthcare facility. But once it is mixed with the non-infectious waste, then the entire story begins. The entire hospital waste then becomes the infectious waste. And dealing with them is very, very hazardous. And you are putting everyone's life at risk. So, as I have already told, this is the biohazard symbol, which you will see in any of the infectious waste or biomedical waste when you are discarding and when you are dealing with, and where these will be the part of your bins, these will the part of your biomedical waste bags. Okay, sharp container. So this is the biohazard symbol. It is very much different than the symbol of the radioactive waste, which is with the which is a triangular shape with a radio hazard label. So we all know what is how this entire thing. So I also have to take I will be taking your session on the managerial aspect of the biomedical waste management. So basically, the entire management of the biomedical waste depends upon how this waste is regulated and how we are dealing with it. First and foremost, there are only two targets, two aims. And what are these two important aims? It is one is to minimize the potential of spread of the disease from a medical setting to the general public, which is very, very important. We cannot, it is morally, ethically, it is not allowable that from the medical setting we, pour, dump, and discard the biomedical waste in the general public, and we are putting the general public at risk. So it is our ethical and moral duty to contain it, discard it in an appropriate manner, so it is not at all a risk to the general public. Second is reducing the entire amount of the biomedical waste, infectious waste, which is being produced. So this will help to protect the environment and reduce the cost of the biomedical waste treatment also. So these are the two basic things which we need to remember in the background while we are dealing with the biomedical waste or the infectious waste. Legal aspect, I will not be going into the details. See the previous rules where the biomedical waste management and handling rules 1998, which is now being superseded by the biomedical waste management rule 2016 and its amendment. We all know this, and it was published in the Gazette on 20th of March 2016 by the Ministry of Environment, Forest and the Climate Change, Government of India. So this is all this much only I will be dealing with it, because the legal aspect of the biomedical waste, the session has already been allotted to someone else, and you will be talked in detail about that during that session. So this, as a part of my slide, it is there, so I am skipping all this. So we all know that where it is applicable and what are its applicability. We all know it is applicable to all the hospitals, nursing home, clinics, dispensaries, veterinary institutions, animal house, pathological laboratory, blood bank, any of the research institution, any of the labs. Important thing which we need to remember, previously it was not there in the health camps, vaccination camps and the blood donation camp. It is the duty of the generator to categorize and dispose and discard the biomedical waste and send it to the common biomedical waste treatment facility with all safety. Okay, so these are all the add-ons to the applicability of the biomedical waste management rule 2016. So per se, it is applicable to each and every site. Maybe in the coming year, it may be being applicable to the home care settings, wherein we are going to the homes, we are providing the health facility. There are many geriatric age group patients, those who need the home based care, so there also the waste is generated. So we need to take care of that biomedical waste also. These all keywords I am skipping off. Basically, when we manage a biomedical waste, the entire thing revolves around the generator. Means the person who has generated, person or facility which has generated, the main onus is with them. So the main key mantra of the biomedical waste management is segregation, and segregation has to be scientifically done in such a manner that it is being segregated at the source as per the category and as per the color code, which is very, very important. We need to understand this very clearly. It is the duty of the generator or the occupier to categorize it as per the color coding, as per the current biomedical waste management rules, segregate it, and if needed, we need to disinfect it at the site of segregation also. Then what comes? Then this entire segregated waste are being, sent to the temporary storage area of any of the hospitals, and after that it goes to the common biomedical waste treatment facility. So as a hospital or as a healthcare providers, we need to have a license. This is a legal liability to any of the healthcare organization. So we need to have a license to generate the biomedical waste, and it is the duty of the occupier to get this license from their state pollution control board and renew this license from time to time. Also, the common biomedical waste treatment facility, which is treating the final waste, need to have the license from the the state pollution control board, and there should be established MOU, that is a memorandum of understanding between the generator of the waste or the occupier and the central and the common biomedical waste treatment facility. Okay, and this segregated waste are transported from the biomedical from the temporary storage area in a dedicated vehicles as per the rules 2016 to the site of the final disposal. So now we are coming to the key point which I am supposed to tell you, the categorization of the biomedical waste and how they are being categorized and color coded. And this we need to remember our lifetime as we are being associated with a healthcare facility, with this profession. May we be a nurse, we be a doctor, maybe be any of the healthcare professional, may we be a lab attendant or a hospital attendant. Everyone, anyone and everyone has to religiously follow this waste categorization and segregation at the site of disposal, site of generation of waste, also during the time of its collection and treatment, and then final disposal, wherever we are doing. So these colors will remain same and same for you every time till its final disposal occurs. Okay, and as per the category, how we have categorized, so there are 4 categories I have already told you. So first category comes is the human anatomical waste. So human anatomical waste is the it's a human tissue organ. So from where these all waste will be coming from. So these all waste will be coming from anatomical waste, definitely after the surgery may come, because if you have uh, uh, mutilated an organ, or you have cut any of the part of the body, or from there these type of the waste will be generated. Anatomical waste also can be generated from like medical termination of the pregnancy act, whatever the fetus, they also comes under the category of the anatomical waste. Also in the MBBS, during the MBBS, specifically during the MBBS time, the first year subject, that is anatomy, all the human organs will come as anatomy. So any of the organ carcasses, anything where whatever is being coming out post surgical, human tissue, human organ, human body part, okay, these and fetus, they all will come under the category of the human anatomical waste and shall be discarded, must be discarded in the yellow color coded bag, which yellow color coded non chlorinated plastic bags. And this Why it is yellow in this categorization of the biomedical waste? It is very very important. The most important color is most important color is the yellow color, and most dangerous color is the yellow color. You need not to do anything to this yellow colored bag or yellow color bin. You are supposed to send it directly to the common biomedical waste treatment facility, and they are supposed to incinerate it, do the plasma pyrolysis. Deep burial is not mandated for the large healthcare organization. We need to give it to the common biomedical waste treatment facility within the 75-kilometer area. They have one incinerator in place, and they will burn the things to the ashes. So there is no any chances that you disinfect it or do anything with this type of the waste. I think I am clear with this. In this, human animal anatomical waste also comes. So first was the human anatomical waste, second is the animal anatomical. From the experimental animals, animal carcasses, body parts, tissues, waste generated from animal used in the experiment, veterinary hospital waste, college waste, they all as got a same. They are supposed to be discarded into the yellow colored bag, and the final treatment and disposal is the incineration only. The third type of the waste which we are supposed to discard in a yellow color bag is the expired and the discarded medicine. It is, of course, a pharmaceutical waste like antibiotics, cytotoxic drugs, and all items. And also, yellow color is, for the cytotoxic drug, there is a symbol of the CE with a triangle in it, and cytotoxic drug are also to be discarded in a yellow bag, but not with the biohazard symbol, but with the symbol of the cytotoxic drug. So these are cytotoxic drugs. Where are they used? They are used in the chemotherapeutic, regimen. So in any of the cancer care hospitals, you will see that there will be a cytotoxic waste being generated. All chemotherapeutic drugs comes under the cytotoxic category, and they are supposed to discarded in the yellow colored bag. Yellow chlorinated and non-chlorinated bags, and expired cytotoxic drugs contaminated with the cytotoxic drugs to be returned back to the manufacturer suppliers for the incineration. So finally, what happens to them? They will be sent back to the manufacturer and then being incinerated, or can be sent to the common biomedical waste treatment facility. And during the incineration, the entire chamber's temperature is 1200 degrees centigrade, and it is a it has got a dual chamber. So at from the 800-degree temperature, everything will be pushed to a 1200-degree temperature second chamber, and in that chamber it will all be burned to the ashes. Okay. Chemical waste used in the production of the biological and used as a discarded disinfectant are also supposed to be, discarded in the yellow category only, yellow colored containers and non-chlorinated plastic bags, and then you can encapsulate them, or the best is the incineration. Uh, Chemical liquid waste also comes under this category, and in the liquid waste, I would like to, highlight certain points. That though it comes under the yellow category, there are many different type of the liquid waste. It can be a biological material. It can be, discarded disinfectants. It can be a X-ray film developing liquid and discarded any of the disinfectant like the formalin, infected secretions, aspirated body fluid, liquid from the laboratories, washing, cleaning, housekeeping, and disinfection activity. So now you'll ask me that how they will be discarded in the yellow colored bag. Basically, they are not discarded in the yellow colored bag. They are being discarded in our routine sewer line, but it has to be connected, routine drainage line, but it has to be connected to a effluent treatment plant, and which is supposed to be regulated by the liquid waste management policy or liquid waste management regulation. And after BOD, COD, and all sort of testing of these liquid effluent which has been treated. Okay, so there are two types of the for the liquid waste management. There are two type of the treatment plant. One is the one is the ETP, and second is the STP, that is the sewer treatment plant. So for the hospitals, the liquid chemical waste, we need to have a effluent treatment plant, which is after this treatment only, with the monitoring, regular monitoring only, it has to be discarded and disposed in the common sewer line. Okay. and and it shall conform to the norms, discharge norms given in the schedule 3 of the biomedical waste management rule. X-ray films developing liquid are supposed to be given back to the vendors, and not to be discarded and disposed of inside this the drainage system. Discarded linen and mattresses, bedding contaminated with the blood and body fluid, again in the yellow. We are not supposed to reuse it, rewash it, and do anything out of it. Yellow, and it will be then sent to the common biomedical waste treatment facility and then discarded. Microbiology and biotechnology and other clinical laboratories. So any of the laboratory personnel has to discard its blood bags, blood lab cultures, specimen of the microorganisms, live attenuated vaccines, human animal cell cultures, everything, anything and everything is supposed to be discarded in a yellow bag. Again, see, in the previous thing, you have seen that yellow colored container and non-chlorinated plastic bags. Can you see the difference over there? Over here, the difference is autoclave safe plastic bags or container. Why we want to push it in the autoclave safe plastic bags and container? Definitely, we don't want to reuse them. And for our primary role as an occupier, as a generator of the waste, we are supposed to pre-treat this waste, and the entire pre-treating has now being pushed off to the autoclaving of the microbiology waste and any of the waste generated in the blood banks. Okay, so blood bank, any blood bag which is discarded, which is expired, everything will go in autoclave safe yellow bags, and they will be autoclaved. Okay, we are not supposed to push any type of the liquid chemical into it. It is very dangerous, and it is not being mandated by the current biomedical waste management rules. Then we come to the category red. So red is for the recyclable. Okay, so waste generated from the disposable item like tubing, bottle, intravenous tube, catheter, set, urinary bag, syringes without needle, vacutainers, okay, gloves. These all will go into the red colored bag. Again, non-chlorinated plastic bags. Autoclaving, microwaving, hydroclaving, anything can be done, shredding, mutilation before the final treatment. And basically, basically these waste are being treated and sent to the registered authorized recyclers by the state pollution control board or central pollution control board, and this entire plastic is being given to them. Okay, and the plastics, whatever this liquid, when they recycle it, they will be used to like resurfacing of the roads and all. Okay, so for the road resurfacing or recovering the plastic to the diesel and fuel oil and all. So the purpose of recycling, please mind well, it is not to reproduce the same items. Like again, we are not going to make any catheter set, urine bags, syringes, nothing. No, we are not supposed to do that. Only thing we are doing, we are sending them, giving them after the treatment of it to the authorized vendors, authorized recyclers, and they will be using it for some other purposes, not in the healthcare facility. Then the other two categories come, that is the white category. So white waste, definitely waste sharps, including all the metals. So needles, syringes, fixed needles, scalpel, blades, contaminated sharp objects has to go into a white container. I have shown a very small pic over here, which is white container with a hub cutter. So what will happen? We are supposed to discard them in a puncture proof, temper proof, leak proof container, which is auto lockable. And when once it is 3/4 filled, you lock it, and you have to submit this entire container. So you can't reuse these containers. So for the purpose of mm, cost effectiveness, you need to design your own methods how you will be dealing with. You also need to design you also need to deal and get these sharp containers at your own settings, and these sharp containers should not be stored more than 48 hours at a setting. So like should not be more than 48 hours, or not more than three-fourths filled. After that, what happens when you give it to the common biomedical waste treatment facility, they may autoclave it, can shred it, encapsulate it, and this can be, so it goes to the metallurgy department. It will be melted, and final disposal to the iron foundries with the consented, those who are having the consent to operate from the state pollution control boards and sanitary landfill or designated concrete waste sharp pit. So this is the final disposal. So that's why there are two categories of the sharp waste. One is specific for the glassware, and second is specific for the sharp waste which is made of the metal. So they will go to the iron foundry. So the entire it has been conceptualized in such a way that it is linked with its final disposal. So if you mix them, then its final disposal will be affected and the purpose will not be solved. The last category under this comes is the broken glass or discarded, contaminated glasswares, vaccine vials, ampoules, body implants. So it will go to the blue puncher-proof container, and then this, the blue puncher-proof container, this will all be the glass will be converted into the molten glass, and then it will be sent for the recycling. So these are all the categories of the biomedical waste. Segregation at the site of the generation is the main mantra, which we are not supposed to forget. And all plastic bags shall be as per the BIS standards. So 75 micron, 50 to 75 micron should be its thickness, not lesser than that. And chemical treatment is supposed to be done at 1 to 2 with the 1 to 2% sodium, 1% sodium hypochlorite, and no chemical pre-treatment is needed before the incineration. So only the pre-treatment needed is in the lab and the blood banks, nowhere else. Else you can send it in the yellow bag directly. So incineration to the ashes will be done in the under the incinerator. Cytotoxic waste, I told you, dead fetus, that comes under the category of the yellow waste, yellow human waste, human anatomical waste. Cytotoxic waste shall not be handed over to the unauthorized person in any of the circumstances. Okay, and they all has to be burned to ashes in the incinerator, which has been approved by the State Pollution Control Board. Disinfectants and any of the liquid waste has to be, as per the Schedule 3 norms, it has to be discarded and disposed of with the effluent treatment plant. And installation of the in-house incinerator is not allowed. So don't ask कि हमारे वहाँ incinerator था, हम उसको चला सकते हैं कि नहीं. It's a very dangerous thing. It's an environmental unsafe thing. You are putting, you are inviting, air pollution increasing, will be increasing the air pollution. Syringes are supposed to be hub cut and mutilated, and the needles are only supposed to be, put inside the puncture proof container. And biomedical waste management, as per the rules, see. So I have told you about the four categories, and there is one confusion in terms that there is a blue color which comes under the biomedical waste also, and it comes under the the general municipal waste also. So in the general municipal waste, it is the swachhta category where the dry waste is supposed to be discarded, and these bags are not puncture proof, and these bags you don't find any label of the biohazard. The blue color of the biomedical waste is not a bag, it is a puncture proof, tamper proof container. So this is all. This is schedule 2 is for the standard for the incineration, standard for the liquid waste also. This is so these are all the standards. So schedule 2, 3 and 4. I'm not going into the legality of it. Packing is very, very important. All the bags should be sealed, labeled from the source of generation, because if anything, any mishap happens, we should be able to, trace it back and get the things corrected. So this is the temporary storage area of, this is a pic of my own hospital, temporary storage area pic. Sorry, ward storage area picture. And this is the temporary storage area picture. You can see some 00 figure is also coming. So any of the waste, as I have already told you, there are two legal things which is attached to it. One is the biomedical waste management, waste generation certificate as per the biomedical waste. So GPCB, like it's a, if I'm from Gujarat, so it is a State Pollution Control Board certificate for the occupier or the generator of the waste, and also to the common biomedical waste treatment facility. So they are the outsource agency which will be, doing the final disposal to us. So, we go under some of the memorandum of understanding, and these understanding are run by some cost. So per kilogram of the cost, they will be taking some money to dispose your waste. So we should be very much cautious that how much, and that's why we all know that we need to reduce the quantity of the biomedical waste, like, not mixing the non-infectious with the infectious waste, so that you are saving the hospital's economy also. Okay, so these, as per the color categorization, these all colors are there, and you can see in the blue one or two doors are there, one green and one blue, it doesn't have the biohazard symbol. Okay, so this is our temporary storage area. These are the dedicated vans. These all vans are supposed to be cleaned once they dispose of the final waste every day, every shift, rather, I will say. These are dedicated vehicles. This is the form 1, this is the form 2. This I'm not going into the details. These are various forms. Okay, two important things I like to highlight you, the waste management amendments in 2018. So the punch-proof containers changed from cardboard boxes to the punch-proof leak-proof containers. So previously they were the cardboard boxes. In 2016 rules, when you Google it, you will find it. It was like that. And in 2019, they have changed the discharge into the public terminal facility. So this liquid waste management, there were some amendments came, and no bedded occupier shall dispose the liquid waste only after the non-bedded occupiers also after the treatment into the sewers. So why we need to adhere to these rules, adhere to this segregation mantra, adhere to categorization of the biomedical waste, because we all know some big brother is watching us. It is a legal liability. So pollution control board is watching you, media is watching you, court is watching you, other higher officials, and you may get notices also out of it. So, and may lead to notice, closure, jail, and fine. So this was all about the categorization of the biomedical waste. I hope I am able to convey which was given in the biomedical waste management rules 2016. If you want to take up question answers, we can take it up, or otherwise we can move on to the next sessions, and in common we'll be taking up the question and answer sessions.
हेलो।
Yes.
यस मैम। मैम मेरे दो क्वेश्चन है। एक तो जैसे अभी आपने बोला था कि लिक्विड वेस्ट को हम डायरेक्टली डिस्पोज कर सकते हैं सीवर में एसटीपी और ईएफटी के थ्रू। तो क्या लिक्विड वेस्ट जिसमें बैक्टीरियल सस्पेंशन भी है, तो जो माइक्रोवेज लैब में नॉर्मली होता है, तो उसका क्या हम इसी तरह से
नहीं
कर
सर,
सकते हैं कि उसको प्री ट्रीटमेंट चाहिएगा?
नहीं सर, माइक्रोबायोलॉजी कोई भी लैब का जो लिक्विड वेस्ट है ना, लिक्विड मीडिया है, वो सारा
उसको प्री
ऑटोक्लेव होगा। ऑटोक्लेव
प्री
होगा।
ट्रीटमेंट होगा।
हाँ,
यस
ऑटोक्लेव
यस।
होगा, उसके बाद ही वो जाएगा।
ओके ओके।
Okay,
और
once
मैम
it will
जैसे
be autoclave, it will be, you know, what will happen? The liquid will actually get evaporated. You know,
ओके
आप
ओके।
ऑटोक्लेविंग के बाद आप देखना, और उसका जो वेस्ट का जो साइज है ना, वो एकदम छोटा हो जाता है ना?
अच्छा अच्छा।
तो और अगर वो लिक्विड रह भी जाता है, then we are supposed to dispose it off. But basically what happens once you autoclave it, you have to submit it to the common biomedical waste treatment facility, and that's why we are emphasizing, and it is told in the rules also, to put it in autoclave safe bags. Okay, so these 50 micron bags of these size, they comes with the autoclavable criteria also. So this is available in the market. I am
और मैम
talking about
दूसरा
the
है।
disinfectant. So whatever the liquid waste we talked about, it was about the disinfectants. You know,
ओके।
like washing आपने करी, CSSD में से कोई वेस्ट आया, या आपके ऑपरेशन थिएटर में से कहीं से कोई वेस्ट आया, जहां आपने, है ना, उस एरिया को डिसइंफेक्ट किया विद द लिक्विड वेस्ट, तो वो लिक्विड आपका कहाँ जाना है? तो बेसिकली दिस विल गो इनटू द सीवर, बट this sewer line is connected to the effluent treatment plant, so it is not going to the direct sewer. Okay,
ठीक है। ओके। और मैम जैसे एक थर्मामीटर्स वगैरह जो होते हैं मरकरी के साथ में, तो उनका क्या ग्लास में जो ग्लास का जो कैटेगरी है व्हाइट वाला, उसमें जाएगा कि उनका कोई अलग से कोई रूल होता है
नहीं,
थर्मामीटर्स वगैरह का?
थर्मोमीटर्स वगैरह में से जो भी मर्क्यूरी है, यू ट्राई टू पिक अप दैट मर्क्यूरी विद द कार्डबोर्ड्स and put it in the inside the water, and then you have to give them to the authorized vendors.
ओके,
Okay.
डायरेक्टली उस पे।
You have to send it them to the authorized. And whatever the smaller grids of this glassware will be there, that you can discard in the this category. But for your update, I will tell you that mercury is now not an environmental friendly. Mercury thermometers are now not environmental friendly thermometers. So people have come and change it, and
डिजिटल
it
वर्जन।
is, yeah, to the digital. So I will,
थैंक यू।
without taking any another, questions, I will be sharing my screen for the next session, which is also very short, and then we'll take up the question answers. My screen is visible.
यस मैम।
So I
यस
will
मैम।
make it to slideshow, and we will quickly go through the managerial or administrative aspect of the biomedical waste. Okay. So, the managerial, so as we all know that biomedical waste management is basically, when we discuss it, when we deal with it, it is not a responsibility of the head of the organization. It is whole and sole responsibility of all the healthcare professionals who are dealing with it. Basically, the first one who is dealing with it is the generator of the waste. Okay, so it's the duty of the generator, which I have told you in my previous session also. The generator has to segregate it at the site of the generation, and then and then it has to be managed in a way as per the legal guidelines, that is the biomedical waste management rule 2016 and as amended. So there are many managerial aspects. So we'll be talking a little bit about the waste audit, and what is this waste audit, and what are these tools, and what are the outcomes of it. We'll also be discuss a little about the SOPs and policies and guidelines related to it. When we are discussing about any type of the management of financial management, and the cost consideration also comes into the picture. So what are the capital costs, what are the recurring costs, what are the contingency costs, and what are the overhead costs? These all costs are supposed to be discussed and dealt with. It's a very, very, huge subject which is connecting the entire all level of the healthcare professionals together. Also, for the monitoring of the biomedical waste, we need to have two types of the committees. If the hospital is more than 30 beds, you can have a hospital infection prevention control committee which can deal with the biomedical waste, can be a part of the HICC. Or if the hospital is less than 30 beds, then you need to have a biomedical waste management committee, okay, which is a mandatory as per the biomedical waste management rules, and what are its function, composition and all. Also its documentation and the record and maintenance, and how so we, all records are supposed to be retained for not lesser than 5 years time. There are various types of the reports being generated which we are submitting to our portals before 30th of June every year. And these all reports are the Form 1, Form 2, Form 3, and Form 4. So annual report we are supposed to, submit Form 4 and Form 1. We are supposed to submit every year. Form 1 if happens, like if any accident happens, and Form 4 the total as per category wise what you have generated and how you have disposed it. This is all supposed to be submitted to the State Pollution Control Board, and they are monitoring it. Form 2 and Form 3. So these are the legal liability application for the authorization to the prescribe authority, that is our Pollution Control Board. And prescribe authority will grant Form 3, which is will grant the authorization. Any of the management, any type of the management, the important feature of management of anything depends upon its monitoring and evaluation. So here also we all know that monitoring and evaluation is very very important. Otherwise you will not be establishing a system of a good biomedical waste management practices, and you need to. And we all know that here, the category of the staff which is dealing with it are having a varied mm, background of the knowledge. It is right from, because healthcare organization is such a mix that here we are having all sort of personnel being working here, right from uneducated to extremely educated population. Okay, so monitoring becomes very very important. So day to day monitoring and the monthly monitoring and evaluation, external and internal peer evaluation is very very important to put the things in place. And after the monitoring, if there are some lacuna you are finding, we need to train and retrain the personnel. So training at the induction and regular refresher training is also a mandate for a good biomedical waste management practices or for good healthcare waste management practices. So these are all the management we will be doing in a healthcare organization. So what you will be doing, like in the from the wards, if the nursing staff or the uh, if the staff is generating the waste, they need to have an inventory of the waste, and this entire inventory is to be kept by the sanitary inspector of your hospital, that from which ward whatever is being generated, because there is a legal liability to upload your waste generation in on your website. Okay, that is as per the biomedical waste management rule. Assigning the responsibility of the waste management, allocation of the human and financial resources, definitely it is very very important. We are talking about the biomedical waste, and you don't have the color coded bags. Just imagine what will happen. It is not the fault of your healthcare worker who is dealing with the waste. The management has to supply all these resources. Also, practicing the waste minimization, including the purchasing policy and stock management practices. Identification at the source of generation, we all have dealt with it. Segregation, collection, pre-treatment. Intramural transportation waste is also a big, big management. We need to transport in a huge hospital setting. We need to transport because there will be a large amount of the waste. So we need to transport them to the temporary storage area through the intramural dedicated routes and dedicated lifts. Okay, during the hours when it is not very busy. So off OPD hours, we need to do this. So when we know that there are certain busy hours, like between 10 to 12 in the morning and 3 to 5 in the evening, or 5 to 7, whatever is the OPD timings of your hospital. So during these busy hours, you are not supposed to transport them intramurally inside the hospital also to the temporary storage area. Then on-site disposal of this waste, that is within the common biomedical waste treatment facility, is supposed to be within your 75 kilometers of the area. Off-site transportation through the common biomedical waste treatment facility, and occupational safety is also very, very important. Cleaning and disinfection of the waste is very, very important wherever it is being mandated, like for microbiology laboratory waste, blood bank waste. We are supposed to, before submitting it to the common biomedical waste treatment facility, we are supposed to treat the waste, pre-treatment of the waste. Spillage also, spillage control, incident management, it's very, very important, because I told you the category of the staff, the housekeeping staff, they may not be so much learned, and they will get, so many needle sticks. So these are supposed to be captured, they are supposed to be trained, retrained, and retrained, so that they don't end up in an occupational hazard. Recording all this is also very, very important, and periodic training is mandatory for the doctors, nurses, paramedical staff, and the waste handler. And awareness of the waste management to the patient, visitor, and the public. So this is the key thing we are supposed to do in the administrative and managerial aspect of the biomedical waste. Now I will be highlighting certain points of the waste audit. So waste audit, we need to categorize very importantly. We need to see how much is the quantity we are generating, and also we need to determine the logistic requirement of the waste, because depending upon the quantity, as I told you, that you can customize your size of the container for your this waste, sharp waste. Okay, sharp waste, like white color container. So how much you will be needing it? So you need to quantify somewhere, you need to audit and find out that how much is your waste generation. Then you will be able to categorize it in one shift. How much is the waste generated in entire day, how much is the waste generated, and then we have to also select appropriate technology for the treatment of the waste and the final disposal also. Okay, so at the time of waste management, at the time of segregation, transportation, storage, pre-treatment, disposal, we need to have certain sort of audit to align the things, align your logistic for the better management of the biomedical waste. So how we can do this activity? So identification of the source of the generation of the waste, what is the quantity, pre-treatment kara ki nahi kara, waste movement also we need to see. So that then you will be, minimum movements of the waste in the intramural route should be there. So then you will be able to locate and design and designate your temporary storage area. Okay, pre-treatment, what has happened? Okay, like do you need an autoclave or microwave? What should be the capacity of that? So personal protective equipment, definitely very, very important, and it's a part of the biomedical waste only. And incidence of the sharp injuries, what are the measures to be taken? So this is how we will do our audit of the waste, and we will improve the biomedical waste management in our own facilities. Okay, so first stage is to visit by the committee members to the areas where the waste are generated, and then document it. We can document it. See, any of the audits when we do, there are, we do it by either by the observation, we do it either by the record review, or we do it by the interview of the personnel. So these all mechanisms you can use. Okay, your mere walkthrough will also tell you so many stories that things are happening properly or not. Okay, then report preparation, and then putting it in the waste management committee for further action, or in the infection control committee for the further action by the administrators. So outcome of the waste audit, type of the waste colored bag, I told you that quantum, you once you generate the quantum, you will come to know कौन सा बैग कितना लगने वाला है पूरे महीने की, what are the requirements. Okay, what are the trolleys will be requiring, how your temporary storage area is supposed to be designed, final disposal options, how far it is available, waste water, do you need a ETP or not? Okay, does it follow the ETP norms or not? Okay, air emissions and all also are supposed to be seen, but now as a generator of the waste, you are not you don't have to go into that, because now the consolidated consent and authorization is being given for air and water pollution along with the biomedical waste generation by the state pollution control board in many of the states. Okay, in some of the state it is still separately you have to take. So who will monitor it? Who will do the waste audit? So it's a infection control committee. I will not be going into the detail. It has to be chaired by the head of the organization. And infection control officer, may it be mostly he or she is a microbiology faculty. Waste management officer you can have in less than 30 bedded hospital, and all departments should be the part of it. Okay, head and maintenance of the cleaning department, housekeeping department, pharmacy, CSSD department, infection control nurse, all major clinical departments should be the part of it, and nursing department definitely, because we want to implement any of the practices in a hospital, nurses are the cadres, those who are uh, basically I will say that they are the one of the sincerest of the cadre I have ever met and seen, and they will implement with all their heart and soul. Okay, so if you want to get the things into, and they are connected to both the levels, like to the doctor level upward and downward to the patient level and the housekeeping level, so they are able to regulate it in a appropriate manner. So HICC, what they will do, they will definitely develop and implement the infection control policy. Here also, the infection prevention and control program should include the healthcare waste management at a part of it, and they have to do a waste management audit, give the data to the committee, and also they have to visit the the common biomedical waste treatment facility with whom you are having your own MOUs, those who are daily taking your waste and doing the final disposal of the waste. Every 6 monthly you are supposed to visit, and it is a mandate. This is the smaller infection control committee, I can say, in the less than 30 bedded hospital. So hospital superintendent with all the composition of the biomedical waste management committee. So here again, waste management officer rather than the infection control officer, it will be a waste manager. So most of the time, if your sanitary inspector is good, he is having a good knowledge, he will be able to control and manage the things in an appropriate manner without any disaster, okay, without any chaos in the system. And he or she has to be supervised by the infection control nurse, nursing superintendent, and definitely they all will be reporting to the hospital superintendent. So they will again a very important documentation of the waste quantum, evaluation of the data, and the presentation and submission of it. Okay. So this is the waste management of officer's role. He will be someone who will be liaising with the connected persons. Okay, so officer, engineer, administrator, finance, post supervisor, attendance, waste handlers, everyone. Okay, so these are yellow are the line management path, and blue are the liaising path. So he or she has to liaison with each and every person. So line management path from where the waste is generated, and the liaising path from where you want to have the resources and finance being put into to manage it appropriately. So head of the organization has to ensure all approvals. Definitely, the biomedical waste management, as per biomedical waste management rule, the legal license has to be in place. All the forms are supposed to be submitted right in time. Designate a waste management officer, allocate sufficient funds, monitoring it. Okay, ensure the training and appropriate record maintenance also. So implement a waste management plan. So this is the waste management officer, waste management plan, segregation of the waste, ensure the correct storage, disposal, coordinate the disposal, on-site, off-site transportation. Definitely we have to see. Sometimes we have to see the off-site transportation also, extramural transportation also. Whether the transportation, I have shown you some of the vans. If these vans are open, you just imagine it will go into the public. Okay, so maintenance of all the record in the prescribed formats, monitor the waste generation, its disposal, even injuries, public health aspects, liaising with the regulatory authorities, and coordination with the inspection teams also. So now we come to what are the needs for monitoring. Definitely, implementation of this can be done only by the monitoring. So waste generation practices has to be a proactive thing. Information regarding the strength and weaknesses, we must know where we want to improve, and we need to set some targets. And if we have certain measures, measure the operation and maintenance performance of the healthcare services related to the healthcare waste management. Okay, so that's why we need to monitor the things. What are the components of the monitoring? First and foremost, have you have all supplies in place or not? Okay, so consumable supplies, if they are there, including all the waste management bins and puncture-proof container, including the PPEs, disinfection, autoclaves, and all, then we need to see what are the practices being followed. Okay, and what are the documentation practices? What are the policies being followed? So who has to conduct the audit? So these are the parameters. Who will be conducting? How it will be conducting? What is the frequency? What is the line of control? Who will take the feedbacks? So these all also we need to, in our managerial and administrative aspect, these we need to discuss and jot down and come out with a policy. So very importantly, a day-to-day monitoring of the biomedical waste management is important. A segregation at the site of generation is the heart of the waste management. It's a key mantra. I have already told you. And then periodic monitoring is also pi. So daily monitoring kaun karega? Who will do it? So your sanitary inspector, your infection control team, your infection control nurses, your head nurses, they all can do this. They all can do this in the routine shifts of their shift duties. Periodic monitoring we need to do with some managerial level, supervisory level of the staff. Here we need to have some personnel like, the personnel, maybe those who are very much involved in the monitoring, like the nursing superintendent, like the infection control officer, infection control team, maybe the hospital administrator, they may all, and then they will be observing, recording, reviewing the segregation at the point of generation, transportation system, occupational safety aspect, testing analysis of the liquid waste, also the mandatory records are being kept or not. And definitely once we submit the audit report, we'll come to know what are the key, what are the training needs. So training need assessment will be done with this monitoring only, and monitoring of the financial aspect also, like cost of the material and consumables. So monitoring components, I have already told you, management. So may include at the point of generation the quantity, segregation, labeling, collection, management of the spill, inventory management, equipment, bins and all, liners, how much it is available, and also the maintenance of the records. Who will conduct all this evaluation? Maybe the internal personnel, and you can ask the external agency also to do it, because they will be the unbiased and the realistic. Evaluation has to be done based on the periodicity. I already told you. An annual evaluation definitely is being done as a part of the hospital policy or as a part of the accreditation body like NABH or NABL also. So this I have already explained to you, and why we are so much worried already being told in the previous slide. Pollution Control Board, media, court, and higher officials are watching us, and it's a can lead to notice, closure, jail, and fine. So this is all from my side. Thank you so much for your patient listening, and now we can take up the question and answers. Okay.
Hello, ma'am.
Yeah.
And first of all, thank you for taking such a wonderful session. I have a few questions.
Yeah,
Ma'am,
please.
firstly, it's regarding segregation. So, where we are supposed to discard the tubes, ointment tubes, or like Locks jelly tubes?
See, logs, jelly, tubes, and all, they are not, if they are not contaminated, they are not a part of the biomedical waste. Once they are expired, they will be, has to be discarded. So it is a pharmaceutical waste. And under the biomedical waste management category, when I discussed, I specifically told that only the discarded medicines and sorry, the expired medicines, you have to discard it in the yellow. Okay.
Okay. And ma'am, rest of the will be going to the general waste
Yeah,
as a
yeah.
general waste. Ma'am,
As a
if we are using that half of the lox jelly we are using, then rest of the things can be thrown in general waste, or it will be going to yellow.
see, if it is generated inside a hospital, it's always a good thing if you discard it in a yellow.
Okay,
Okay,
ma'am.
because we
Ma'am,
don't know with what hands, with what all cross contamination it has. Because once it is opened in the hospital setting, it's better to discard it in a yellow.
okay, ma'am. Ma'am, next is like some of the medicines comes with the glass. For example, injection locks. So if it is expired, then we have to discard the medicine. We have to take out the medicine and discard separately, or along with the medicine we can discard in
We
the.
have to, along with the medicine only, we have to discard.
Okay, okay. Thank you, ma'am. Next is, ma'am, some practices were there, like during our training period also, we were told that you should cut the IV tubings and then discard in the red bin. So shall we follow this practice, or?
Yeah, this is a good practice and you can follow it, not an issue. But only thing is that you are supposed to discard it in a red,
Yes, ma'am. For sure,
non-fluorinated.
ma'am. In red only we are throwing. Ma'am, next is about needle burner. Is it advised, or?
No, nowadays needle burner is it's not an environmental friendly procedure. So needle burning is not advised, but needle hub cutting, like syringe hub cutting, is very much advised. And that is also a part of, like, you are because it's a plastic waste. The hub,
Yes,
once you
ma'am.
cut it, it's a plastic. So your syringes will not be reused.
Yes,
So to
ma'am. That we
prevent the
used to
use
crush.
only. Yeah. And
Okay.
otherwise you have to, in a puncture proof container, we need not to burn it. You cut it. Once you cut the hub, what will happen, it will fall down in the puncture proof container, and once it is 3/4 filled, you lock it and send it to the common biomedical waste treatment facility.
Okay, ma'am. Ma'am, next is some of the hospital there is one common practice of dipping the glass waste and sharp waste in 1% hypochlorite
No,
solution.
no, no. It's not
So
mandated nowadays. See, very, very importantly, any of the sharp waste, we need not to decontaminate it. It will be the final disposal. During the final disposal, it will be taken care of by the common biomedical waste treatment facility. So we need not to manipulate it.
okay, ma'am. Okay, ma'am.
Okay, so
And ma'am,
in empty containers only, without any liquid disinfectant, you are supposed to put it.
okay, ma'am. Ma'am, next is about the HIV infected or hepatitis B infected waste. So for that, the anatomical waste we are throwing in yellow bins and labeling it as HIV positive waste like that. Then, ma'am, but what about the sharp waste, infected sharp waste?
So when as a healthcare professional, okay,
Yes, ma'am.
so are you able to find out those who are in the window period?
No,
No.
ma'am, we
So
are
that's
not
why I'm
able.
telling you need not to. So see, what you are doing. This is basically breaching the confidentiality, and this is basically, you need not to. You have to consider each and every biomedical waste as a infectious waste only.
Ma'am, actually, in some of the OT cases, like prior
whatever
OT,
whatever in the OT cases, these practices has to be changed. Definitely you will be
okay.
taking some of the contaminated surgeries in the last
Yes, ma'am.
settings
Yes,
of the
ma'am.
OT. That is absolutely
Mm-hmm.
fine. You take extra
Mm-hmm.
precaution. You wear the entire PPE, you wear the double
Mm-hmm.
gloves. It is absolutely fine. But the waste management remains same, because
Okay, okay.
when you autoclave it at 121 degrees centigrade
Yes, ma'am.
for 1 hour, everything is going to go away. Okay, so you need not to have any in entire, when you go to the biomedical waste management rule 2016 gadget, nowhere it is written as HIV reactive or HBsAg reactive. So these are the
Okay.
terms which are there inside our mind, and we are
Ma'am,
not
these are the practices that so many people are following. So I was
See, we
having
need
doubt
to
because.
change, na, somewhere we need to
Yes, ma'am.
change. I think your name is Sheetal.
Yes,
So
ma'am.
Sheetal, we need to change our mindsets also. With the
Yes, ma'am.
learning, we need to change our mindsets.
Because I have worked in different kind of hospitals, so every hospital is following different kind of protocols. So,
Definitely, they are following different kind of protocols, Major thing they need to follow is the categorization of the waste has to be done as per the color coding defined by the biomedical waste management 2016 rules. And second thing, they should not be, why we are managing the waste in appropriate manner, there are two important things, that we are saving ourselves, we are not putting us at the occupational risk, and we are not also putting the public at risk. So these are the two important key factors we need to keep in mind. Everything else is a anxiety, you know.
Yes, ma'am. Okay. Thank you, ma'am. That's all.
Hello. Hello.
Yes,
Good evening, ma'am. Actually,
very good.
I want to ask a question. This जो syringe, insulin syringe, attached needle, वो हम लोग को कहाँ पे डिस्कस करना होगा?
इंसुलिन सिरिंज जो भी अटैच नीडल्स है ना, वो आपके वाइट शार्प कंटेनर में जाएगा,
White
क्योंकि आप नीडल निकाल नहीं पाएंगे ना उसका।
ओके ओके और एक क्वेश्चन था मैम, फ्यूमिगेशन अभी एडवाइस है या वो
नहीं
अभी
नहीं, फ्यूमिगेशन इज नॉट एडवाइज्ड, एंड फ्यूमिगेशन जो है वो आज के हमारा सेशन का ऑब्जेक्टिव में भी नहीं है, ठीक है।
ओके ओके
तो
मैम,
उसके ऊपर हम ज्यादा डिस्कशन नहीं करेंगे।
ओके 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 मैम, ओके ओके, थैंक यू मैम।
थैंक यू।
Hello,
यस
Trini ma'am. Ma'am, can you please just revise that the component of waste management first point, that is compiling of inventory waste.
पार्डन, आई डिड नॉट गेट यू।
Ma'am, regarding the component of healthcare waste management, there is the first point, that is compiling of inventory waste.
दैट इज अ वेस्ट ऑडिट यू वांट टू टॉक अबाउट।
Ma'am, actually,
So inventory was, we discussed the waste inventory in the waste management, that is a managerial aspect. वेस्ट इन्वेंट्री मीन्स कि वेस्ट का मैनेजमेंट करने के लिए आपको कौन सी चीजें चाहिए होंगी, उनकी अवेलेबिलिटी कैसे है, और कितनी क्वांटिटी में आपने वेस्ट जनरेट किया है। तो ये सारी चीजें दे आर ऑल इंटरकनेक्टेड। So inventory of the waste means, from a particular ward every day, what is your minimum quantity of the waste you are generating, or an average quantity of the waste. तो वो इन्वेंट्री मैनेजमेंट हम इसलिए करते हैं, हम इसीलिए है ना, टोटल नंबर ऑफ द क्वांटिटी हम हर एक वार्ड का, यूनिट का हम इसलिए लिखते हैं कि हमको एक आइडिया आता है कि हमको हाउ मच द रिसोर्सेज वी आर सपोज टू प्रोवाइड देयर, सो दिस इज अ मैनेजरियल एस्पेक्ट ऑफ द वेस्ट।
Okay, thank you, ma'am.
Good evening, ma'am.
Yeah, very good evening.
Ma'am, can these presentations be shared?
Yeah, I don't have any problem sharing it. I can also share. So probably I'll be sharing it to Madam, I think Dr. Ruchika Kuba. So because I don't have the access to your mail IDs and all, or I may be sharing it to the regional center, Bhubaneswar, who is coordinating this.
Thank you, ma'am.
Any other questions? I hope I was able to clear your doubts regarding the biomedical waste management.
Yes, ma'am.
Yes, ma'am.
Hello, ma'am.
Yes.
Ma'am, regarding the disposal of stock waste like needles and implants and all, is it mandatory to autoclave here, or can we directly send to common treatment facility?
No, needle and all from the wards, anything which from the clinical areas of the hospital, whatever you are generating, you need not to pre-treat it. Okay, so they has to be logged like in a smaller container. If you I don't know how large is your facility, you need to put them in a puncture proof, tamper proof container without any disinfectant, and you need to submit it to the waste transport agency or the common biomedical waste treatment agency.
Okay. One more thing, like in a larger hospital, like if it is more than 500 bedded hospitals,
Yes.
it is very difficult for an individual to crush the needle and dispose it, because like if you are working in emergency medicine
we
department.
No, we need not to do the crushing of the needle. You know, you can in from the emergency, what you can do, you can have a protocol or policies in place, like all the emergency tray. Once you complete the procedure, after that, from the emergency tray, you can have a needle cutter along with your white puncture proof container, because they get very with the needle cutter, it get very well attached to the puncture proof container, and then you can cut the hub and discard it. So once you complete, so clinical care of the patient should not be compromised, and later on you can do it, but not like you need to complete you need to complete the clinical care of one patient and then dispose this and then go to the next patient.
Okay.
So you
Currently,
can't
all
mix
those.
all.
Okay.
It's
Currently, all those shock.
advisable to not to mix in between the patient, but if the load is huge, you can design a mechanism wherein your safety is not compromised. You know why
Okay.
we are cutting the putting it in a puncture proof container? Only fundamental behind it is that we are saving ourselves from risk. You know, it's for the occupational, it's for the prevention of the occupational hazard, you know.
Currently, we are actually disposing it in a puncture-proof container. But cutting the hub of the needle, it's a time-consuming thing for an individual, like for a doctor or a nurse, because we are getting a huge number of patients. In that case, can we directly put those needles into the puncture-proof container, and can
You
it be
can
sent to the
put it,
common
but
treatment facility?
what will happen with two hands, you will be manipulating it. You know, with one hand you will be removing your syringe, and the other hand you will be pushing off the needles.
Needles.
So
Okay.
you can define your own mechanism, but there are all chances, if you're not cutting your hub and you are manipulating it, there are all chances of the
Uh,
needle stick injury.
No, ma'am.
and the main
There's a
thing
thing that
that which we are worried about is like we should not reuse the syringe, correct, Nama?
Yeah, we
So
should
in
not
that case,
reuse
if
the
we are
syringe. That is not acceptable.
in that case, if we are using auto-lockable syringe, then I think so there is no need of cutting the hub. Is it right or is it wrong?
Yeah. There, when you are using the auto lockable, there is no need to cut the hub.
Okay,
You can
thank you,
directly
thank you.
dispose of them in the puncture proof containers.
Okay.
ma'am, there's one thing that I want to tell you, ma'am, for asking. The the puncture-proof container that we have in our facility is there's a notch kind of thing there, from where you can just take off the needle. You don't have to cut the whole thing and put it in the puncture-proof container. There are chances that if we are putting it in a from a hub cutter to the puncture-proof container, the spillage is there if we
No, it's
try.
not there. It's not there. That is absolutely a closed system. So, so spill is not going to happen.
Because in our facility there are smaller puncture-proof containers there.
So, that's why I told you that your waste management audit will help you to design your own, resources. In terms like we in our hospital settings, we have designed the needle cutters, the hub cutters, and the size of the puncture proof container as per our requirement. So that
In the
designing
hospital
is
setting,
absolutely possible.
we get it from the store, or only the
That's what I'm
smaller
telling.
ones.
स्टोर भी तो कहीं से खरीद रहा होगा ना. आपका
मैम
स्टोर है,
गवर्नमेंट का
आप
स्टोर है.
स्टोर की तरह भी मत सोचो. यू जस्ट इमेजिन वो कहाँ से प्रोक्योर कर रहे हैं. ठीक है, जिस भी एजेंसी से वो प्रोक्योर कर रहे हैं, यू कैन गिव देम योर रिक्वायरमेंट्स. It's, and if it is a good quantity, definitely they don't want to lose the business and they will do all modifications for you.
Okay, thank you.
Any other questions? RC Bhubaneswar, is anyone from RC Bhubaneswar? I request someone from RC Bhubaneswar to join. If there are no more questions, then we can close it. Wait for a while, I'll call them. So I think we can close the session if there is no question and answers, and you can, get connected to your coordinating regional center for any of the question and answer through email also. And I hope I was able to clear the doubts. And also, if you have any feedbacks regarding my session, you can definitely share. As a professional and a faculty, I also need to improve myself. So you can share the feedbacks also to your regional center, as I don't have any connection, direct connect with you all. Maybe the regional center may coordinate the things. So thank you so much for all your patient listening. And whatever the material and the study material and all the licenses and all I have, like gadgets and all I have along with me regarding this session, I'll be sharing it to all of you through your regional center. Okay. So may I leave?
Thank you, ma'am. Thank you so much.
Yeah, thank you so
Thank
much.
you.
It was wonderful interacting with you all. Thank you. Thank you.
Thank you, ma'am. Thank you.
Thank you.
बाहर ही नहीं आया अभी तक।
हाँ ज्ञान बन रहा है